Good afternoon, and welcome to our daily COVID-19 update for the town of Plymouth. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day beginning next week, Monday and Thursday at noon. Today is update number 53. It's coming to you live on May 28th, 2020. We do date stamp each of our presentations, and this forum is being brought to you live on PAC TV by Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org, and these forums can be replayed at pactv.org/Plymouth. Today, we are joined by a panel that include Dr. Phillip Triffletti. He is an attending physician at Beth Israel Deaconess. Also, Brigitte Keene. She is the chairwoman of the Plymouth Board of Health. Also, we're joined by Bob Eisenstein. He is a senior living planning consultant. And Stephen Cole. He is the executive director for the Plymouth Regional Economic Development Foundation. And they're all joining Matt Muratore and our chair of our Board of Selectmen, Ken Tavares. Welcome, Ken.
Thank you, Steve. Good afternoon, everyone. Today, I thought I'd take a different approach in bringing a greeting to you. I do not have anything of substantial new information in regards to the town. Perhaps we'll have more tomorrow. But I'd like to take a moment now to memorialize the over 100,000 people that have died in our country. 6 months ago, we couldn't have imagined this, but it's happened. Also, out of that 100,000, 51 of the deaths are recorded in Plymouth, and 48 of them at facilities. But I think it's time to reflect for a moment or two with the families, those that have lost loved ones and dear friends. So with your permission, Mr. Moderator, I ask we bow our heads in sympathy to the families that are going through so much in our country now. Thank you. Back to you, Steve.
Thank you, and that is Selectman Chair Kenneth Tavares. He's joined us each day for our updates, and I'd like to announce that on Monday, I will be giving further information regarding Plymouth's annual and special town meeting. They are currently scheduled for June 15th, and we expect to have further information for you on Monday. At this time, on our Thursday segment, we're going to continue with my brother, Dr. Phillip Triffletti, who is now a great uncle. Welcome, Phil.
Thanks, Stephen. Thanks again for having me on your program. Well, I wanted to start off with just describing what it's been like practicing as a primary care physician with some of the questions that I've been getting about, what to do during this coronavirus pandemic. One of the most common questions actually that I'm getting is a lot of people are wondering, should I be tested? And I think it's probably worth going over this again. I think I've mentioned it a few times in past segments, but I would like to just explain a little bit about the different kinds of tests, basic things, and how they might be used. So the gold standard for proving a diagnosis of COVID-19 is to do a test to look for the virus. So that's the one where they use the nasopharyngeal swab, and they'll put the swab directly back through your nose. And that particular test, you may have heard in the news, there's rapid testing, like the president, was using a type of machine where you might get information in 15 minutes. There's also, other tests that are done in the hospital laboratories. They're probably a little more sophisticated, a little more accurate. Those tests might take 12 hours or so to run in a hospital laboratory like our Boston campus, for instance. So if we want to prove if somebody is infected and is currently contagious, that's the test we would do, a nasopharyngeal swab. And so that test, I think, has, great value in terms of diagnosing patients, but it's going to probably have a limited time span that's going to help you because when somebody gets infected, perhaps the first 2 or 3 days, that test would not likely be positive, but maybe by day 3 of infection through maybe day 10, there's a window there where you would be shedding enough virus and you would be contagious, and that nasopharyngeal swab would show a positive test result. So that, is helpful in diagnosing illness, but the further you get away from the time of infection, if you get out to 2 weeks, 3 weeks, 4 weeks, some people talk to me 8 weeks later, then that test really wouldn't be helpful in diagnosing infection the longer you get away from the time when the infection actually started. The antibody test, on the other hand, is kind of the opposite of the nasopharyngeal swab, which is sometimes referred to as a PCR test. The antibody test is a blood test, and that blood test, usually you're not going to show antibodies in your bloodstream till about 14 days or so into the infection. So once people have sort of passed the window, if they were to do a COVID nasopharyngeal swab test and it came back negative, and it's been a couple weeks since they thought they were infected and they still were suspicious, they might go ahead and do an antibody test to see, were they actually exposed and do they have antibodies that indicate infection. And of course, there's a lot of concern about both of these tests in terms of their accuracy. The nasopharyngeal swab, in some cases, have been reported to only be as accurate maybe as 50% of the time. I think our hospital lab at our Boston campus feels like it's about 97% accurate when it's done in the hospital lab. Some of the other rapid testers maybe, miss, 15% of the time or 30% of the time. So I think that's something you always have to keep in mind if you get a negative test on nasopharyngeal swab, but you have all the typical symptoms, you might have missed it with what we call a false negative. And that's when the antibody blood test as a backup is helpful. I think in most cases still in Massachusetts, except for, there were a few towns that were offering unlimited testing to people who had no symptoms. I think in most cases, like our Boston campus, our Plymouth campus, are still predominantly, they're testing people that have symptoms. So I think that for the time being, you'll still be, facing those types of protocols when you're interested in getting tested. As far as what's going on with the phase 1 process of reopening for the healthcare system, at our Boston campus, for instance, we're still not going to be doing any elective procedures till June 6th, so that's about another week. In the outpatient, like primary care, what I do, we're being encouraged still to really only do things that have a significant impact on the safety and welfare of patient care. We're being asked not to do routine care. So if people needed just something routine done, we would probably postpone that. If I've had some people, for example, have bad arthritis of their knee or had bursitis in their elbow, and I had to come in the office and do a procedure with a needle to, inject cortisone into the knee. That type of procedure, obviously, you can't do virtually as a telehealth visit, but so those are the kinds of things that we're doing in the office right now. I'm still encouraging all my patients to do telehealth visits as much as possible, because I still feel that, you want to reduce any risks of contacts that you might have with, if you come to an office, other patients, although we try to stagger that, with the staff or, even with myself. I think you never know when somebody might be infected. And so you want to try to, minimize those potential contacts. In regards to the vaccine, as we've spoken before, there's probably over 100 in development. It's still, I think nothing great to report. The only thing I did hear this week that I was a little disappointed to hear was that it appears that coronaviruses, compared to other types of viruses, when we get infected with those kinds of viruses, the immune response in our bloodstream tends to be somewhat weaker than it might be with other kinds of viruses, say maybe a monovirus or some other type of virus, where we get a much stronger immunity that lasts a whole lifetime. So that's one of the problems that we'll probably be facing, whether people get natural infection with coronavirus or with the vaccine, that our bodies don't tend to make a strong antibody response with the coronavirus. So obviously we'll stay tuned to all the interest in the vaccine. I still think that's one of our biggest hopes going forward for really, stopping the pandemic, obviously. And I did also heard on the news this week, I was quite surprised, to hear how differently some countries have dealt with the pandemic. And I was, totally astounded that the Hong Kong as well as Taiwan had unbelievable control of this virus. And, they're big countries. Hong Kong is, I think, about 7 million. I think Taiwan's like maybe 26 million people. And they're very close to China. And so they managed somehow, through, be very, very careful with screening and doing that, what we've referred to as contact tracing. Hong Kong only has had 4 deaths so far, and Taiwan has had 20 deaths, which is, incredible. I think when you think that they have millions of people and they somehow, were able to put into practice all the things we're doing here with social distancing and wearing masks and hand hygiene. They were able to, really prevent the spread of this virus. So, I hope that we hear more. I hope our government officials and public health officials really study carefully what have been done in those countries, because it's astounding really what they've accomplished. So, as I've said in previous segments, I think, you want to assume you're infected. So wear a mask to protect others around you. You want to continue doing social distancing, try to resist temptation to, have casual gatherings. I think a lot of people were upset with some of the video that came out of Missouri, the Lake of the Ozarks, showing, hundreds of people in a pool. There was no separation. There were no masks. I'm sure there are isolated cases where this is happening. I think we should remember, probably in the state of Massachusetts and even in Missouri, most people are doing the right thing and taking the proper precautions. You get things highlighted in the media. It can be upsetting to see it, but I do think that most people are, trying their best, and I think we all should continue to do our part to prevent any further spread of the infection. So that's all I have to say to start. And of course, as always, I'll be happy to answer any questions in the later segment of the program. Thank you.
Thank you, Dr. Phillip Triffletti, attending primary care physician, Beth Israel Deaconess, Boston campus. We begin each day with our health segment, and today we're also joined for the health segment by Brigitta Keene. She is the chairwoman of the Town of Plymouth Board of Health. Welcome back, Brigitta.
Well, good afternoon, and thanks, Steve, for inviting me today. I'd like to thank Dr. Triffletti for what he's just said, and some of what I'm going to present today is really just going to be a reinforcement of what you've just heard. I'm sure that we all hope that today's viewers know that we are in phase 1 of the governor's plan to reopen the state, and each phase is a minimum of 3 weeks long. And a reassessment of critical factors will have to be met before moving to the next phase. So we don't yet know if phase 2 will begin the second week of June. We started phase 1, as you know, May 18th through 25th. So there are many people that are eagerly anticipating phase 2. The phases are important because in each phase, businesses are given specific guidance to reopen based on how businesses that have reopened are impacting the spread of disease. And I'm going to test myself on share screen here for just a moment. And I'd like to bring this up. Let's see, let me try again. Hold on. There, I'm wondering if you can see this. This is an example of a mask. What the Department of Public Health has put on the town's website and is actually adding to a lot of the, anywhere that we can post this. Masks are shown to reduce the spread of disease. It took us a while in this country to understand that. Masks are so foreign to us. If you don't work in healthcare, you probably have never worn one, and they're uncomfortable, but we're getting used to it. And I think as a country and as a town, we're understanding more that if you wear a mask, you can probably reduce the spread of disease in our town by about 80%. So it's a good thing. Wear it. It's a nice reminder to everyone. And these reminders will be everywhere this summer. So hopefully that share screen has come down. Let's see. I also, the reason I bring this up is that with this in mind, the Board of Health met yesterday with invited guests from the town staff to present an update on recreation at beaches, at ponds, at parks, all of our wonderful outdoor settings. And there was some ability to assess the town plans based on the Memorial Day weekend. I encourage everyone to go to the town website to learn more about recreation in Plymouth during each phase. The town has done a lot of detailed work to stay within the governor's directives. Also, please be aware that the governor's orders to preempt the town, including the governor's orders preempt the town. In other words, they take precedence over the select board, the Department of Public Health, the Board of Health, from altering any directives in any way. The town is required to comply with the governor's opening program, the 4 phases. So recreation in Plymouth this summer is going to be controlled by limiting parking at all town beaches and recreational sites to residents. Walking into recreational sites is not limited unless congestion warrants closure. What that means is if you can walk into a site, you're welcome to be on the beach, in the park, and you won't be asked to leave unless it's hugely congested and people cannot safely be in that close of proximity. What I'd like to stress is this: parking is going to be limited to residents and stickers in town controlled areas. So I'd like to say this: if there are 100 stickered cars that are allowed in, and yours is number 101, and you're turned away, please do not take out your frustrations on the young seasonal workers that deliver you this news. Please be kind. Please be understanding. This may be your neighborhood child trying to make some summer wages, because we know that frustrations may run high if you've piled your children into the car and you think you're going to get on the beach, and you may not, even if you have a sticker. Let's understand and let's be kind. I'm going to try again to share my screen with you to show you a few more Plymouth specific numbers here. Okay, let's see. I think, are you seeing numbers or are you seeing something else here? Here we are.
Mandatory safety standards for the workplace.
Okay.
And the 4-phase approach to reopening Massachusetts.
Right. All right. This is the 4 phases that I was talking about. I think everyone can find this on Massachusetts website, on the Plymouth website, and we are certainly in phase 1. The focus of all of these are, of course, social guidance, which is gathering sizes and social distancing and face coverings again. Mandatory safety standards for workplaces. We have done this in Plymouth. All of our workplaces are either have completed or will complete these mandatory safety standards, and they are available to be viewed by the Department of Public Health by request. But I think what's really important are these sector-specific safety and best practices. If you have a small business and you don't know how to find these, please call the Department of Public Health. Please email the department or email me or any of the board members. All of our emails are available on the town website. And this is what a mandatory safety standard for workplaces looks like. There's a checklist that goes with this, but it addresses all 4 of these areas, such as social distancing, again, a very important measure to take in order to reduce the spread of the virus, hygiene protocols that we've talked about, staffing and operations, limiting the staffing and the number of people that can be in an office space, and cleaning and disinfecting. So these are important. And I'd like to then bring up one more share screen, and I appreciate you. Okay, let's see where this is. Are you seeing a chart in front of you?
Yes, confirmed cases by gender and confirmed
Yeah.
cases by age.
All right, so let's start with these confirmed cases by age. This is some of the work that your Department of Public Health is doing to understand how the disease is spreading in the town of Plymouth specifically. So this is an interesting diagram, as you heard from Chairman Tavares. We now have, let's see, 519 confirmed cases as of last night. Or was this Dr. Triffletti? I don't remember. And 47 deaths in our town. So let's take a look at this. You'll see that the youngsters here between the ages of 11 and 21 are only registering 21 confirmed cases. This is by testing. We don't believe that this is an accurate number because our young kids probably are asymptomatic and are not going in for testing. But we don't know that for a fact because you can't really know who is asymptomatic just by definition. But if you go through all of the other ages, you'll see that most everyone except the 51 to 61 group has just about the same rate of infection in our town. We anticipate that the 51 to 61, that group may be registering because they go for testing more often. They may be the group that's working as first responders or healthcare workers. They may be essential workers, but they may have some more access to testing and may not be infected at a higher rate due to their age. Those might be some of the reasons, but certainly I would welcome Dr. Triffletti if he has any more insight or thoughts about this graph. But let's look and see when we take our infection rate and then we go to the deaths and the age range in our death. Now, all of these data were presented yesterday publicly at the Board of Health meeting by the Director of Public Health. So these are current and have been presented by the department director yesterday. So take a look at really where our deaths are centered. No one under the age of 60 has died in the town of Plymouth. Our deaths are concentrated in the 81 to 90-year-old range. And then you can say the 80 to 100-year-old range is the vast majority. And I just want to tell you, at one of our facilities in Plymouth, it was a good news story that a 101-year-old woman survived COVID-19, and she's quite proud of herself. She's quite happy with that. So these are our death ranges. Now, one reason that we think that testing may not be as robust in Plymouth is because of one factor. What you'll see is that we have close to, we have about 50 deaths and we have about a little over 500 positive cases. Well, that gives us a 10% range of deaths, which is very inconsistent with national and international data, even with Massachusetts data, which is showing a rate that's much closer to less than 2%. So as a percentage of those tested and positive, we still have a high rate of death, but there may be other reasons. And as a Department of Public Health and a Board of Health, we are going to begin to drill down into these data to understand those reasons better. So I'd like to also go to another slide, and this will be the last graph that I'm going to show you on the graphs. And those are confirmed cases by gender. While we don't have, one reason this graph interests the Board of Health and the Department of Public Health is that we have 36% male and 62% female that are testing positive. And we can basically ignore the unknown. Because it's the exact opposite of what we're seeing in the state and what we're seeing actually nationally. We're seeing more males infected than females. So we don't think that Plymouth has more females than males. I think that our demographics are probably slightly skewed female. Our demographics are slightly skewed towards elderly, meaning over 60. But we think that this may just be behavior. It may be that the male behavior is not to get tested as often as the female behavior is to get tested should they show symptoms. But we're going to drill down into that. I'm going to bring up one other graph, and this is going to explain the deaths in Plymouth. So let me take this down. Because the deaths that we have, sorry, let me take this down. This is my script. Okay, hold on. As much as I'd like to be facile in this, I'm not. So you can see this pretty much, hopefully, on your screen. Where are we seeing the results of those that are not surviving being infected? We're seeing it in our congregate settings, and we're paying extreme attention to congregate settings. We do tend to have a slightly older demographic in Plymouth, and we have multiple congregate settings. So this was presented again yesterday at the Board of Health meeting. At Laurelwood at Pine Hills, we see that no residents are positive while some of their staff are, and these staff, of course, are not working until they're cleared, and there is a very strict protocol for clearing. At the Stafford Hill Assisted Living, you can see they have 85 beds, and their staffing is good. We check in every single day, and every one of these facilities has a state epidemiologist that's assigned to them. And they have a strict program of support from the state and from us here locally. So we have 7 deaths out of 21 residents that were positive and 14 staff. Again, at Plymouth Crossings Assisted Living, again, their staffing is good and they have no PPE needs. They've experienced 4 deaths, 14 positives. 20 residents positive, 14 have already recovered, and their staff is also recovering at the same rate. The Life Care Center of Plymouth is a skilled nursing facility that we're watching very, very closely. They're very large, their staffing is good. They do have some need for gowns, and we have made that request to the state so that they are 100% supplied with their PPE needs. They do have 68 residents that are positive, along with 42 staff, which has contributed to 20 deaths of those in Plymouth. They are testing those with symptoms, and most likely going to be testing, moving towards testing all at the Life Care Center because of their number of deaths. We've added the Newfield House, a very small 45 beds. And they have experienced, again, 5 deaths. They made a request to for support to the National Guard for assistance. And then we have Harborside with 88 beds, 12 deaths, and 5 died within Harborside and 7 died at BID Plymouth, who continues to have the space and the capacity to care for those who are positive with COVID-19. So I wanted to give you this analysis, and and really tell you that the epidemiologists are assigned to these facilities. The nurse supervisors are in touch with the department every day. We check through their staffing, their PPE needs, and make sure that those that are in what we call congregate settings are getting all the care that they need and that they deserve. And in that respect, what I'd like to just finish with is Dr. Triffletti mentioned testing by symptoms only in Plymouth. And that's really the case at the BID Plymouth Hospital facility and in most of the facilities that provide testing around Plymouth. But we do have one facility here in Plymouth, which is your local Walmart. So the local Walmart is doing testing for anyone who wants to be tested. You don't need a prescription to do it, but you do have to call in and register. They're open 3 days a week, 2 hours a day, and it's a self-testing facility. They're very facile with that. What that means is they hand you the swab, they show you how to do it, you give it back to them. And so if you go on to the Walmart website in the town of Plymouth, you're going to find how you can sign up for this, even if you are not symptomatic, to get tested. And unless there's some questions later on, I want to thank you very much for allowing me to present today.
Thank you. That's Brigitte Keene, and she is the chair of the Plymouth Board of Health. And at this time, we welcome back Robert Eisenstein. He is a senior living consultant. Welcome, Bob.
Oh, thank you, Steve. Good morning, everybody, or good afternoon. Starting to lose track of time during this home quarantine. As Brigitte mentioned, just one thing I wanted to point out. We left off Plymouth Rehab Facility off of the report there, and that's one of the larger nursing homes in town. And I see you smiling. They had 0 infection rate, last news that I heard, which is a tremendous shout out to them. I think Matt's going to be reporting on some of the statewide numbers, and just to give you the perspective of the scope of what's going on in the senior living facilities. And by that, we're talking about nursing homes, assisted living, some of which Brigitte mentioned, all of the senior settings, independent living, group homes, rest homes, et cetera. Statewide, there are some very positive trends that we're thankfully starting to see. There's been a decrease in hospitalization rates, a decrease in positive results from testing. But as you can imagine, when you're looking at the percentage which hits the elderly in greater numbers, unfortunately, the nursing homes are still suffering from some of these numbers. For example, statewide now, the average age of death for the entire state is 82 years of age. If you take the over 70 population, and these were from the Department of Public Health portal that was posted just yesterday, if you include all those over 70 years, it's 85% of all the deaths. So the good news is that I think, as I reported last week, the testing surge that has happened in the nursing homes is almost complete. As of May 25th, all the nursing, I'm talking about skilled nursing facilities specifically, but all the senior care facilities that wanted to take advantage of Medicaid funding, if they're receiving federal funds, you can get enhanced funding from doing testing. You had to meet a 90% of all of your staff and residents needed to be tested as of May 25th. And I'm pleased to report that 97% of all those facilities had reached that milestone. What does that mean? That means, unfortunately, we're going to see more positive cases temporarily. But I will, just to give you some of the specific numbers on that, for a 1 week period up till now, 47,192 tests were completed in all the senior care facilities across the state. As of week ending May 27th, we had 20,267, a little over 20,000 that were positive for both residents and staff. And while that seems to be a big number, it's only an increase of a little less than 3,000 from last week. And the number of facilities that have increased in terms of, we gauge it by at least having one positive case or more in their building. At this point, it was 348, only up 4 facilities from 344 last week. And most importantly, the number of deaths in the senior living facilities, although still, as we said, a horrible number. It was 340 in the last week. That's down from 363 the previous week. And I think as I've been reporting since May 1st, it was in the 600s for a little while at the beginning of May. So I think what we're all seeing is hopefully, and again, we've got to give a few more weeks to make sure these numbers don't spike again. Brigida and also Dr. Triffletti talked about the phases of reopening. The nursing homes have very specific guidelines that are also very detail-oriented to the infection rate, care level, and the goal obviously is to get to 0 positive cases in the building before we can reopen. I was on a Department of Public Health call yesterday for all of the nursing facilities in the state, and it was brought up that families and public in general are getting very frustrated with the visitation restrictions on nursing homes. And we all felt, our hearts go out because people are asking, how can we visit our loved one? That's the bad side of it. The good news with that is it is absolutely working. I mean, you can talk to all the public health folks on the panel today. The only way we're going to stop the infection rate in the nursing homes is to continue to ban visitation. Right now, once they get to 0, we've got to make sure that they're able to get through that phase. And then all staff that come in right now are tested every morning when they come in. They get their temperature checks taken. They're asked to report on any symptoms. So there's a lot of control going on. Along with the numbers in terms of testing and death rate, the PPE had been a big concern on the call yesterday. And the state command post has filled out 6,000 requests for personal protective equipment over the last month. So there is a command post. And one of the good news items they said is the routine supply chain where all the private medical suppliers are now more open for business. They're able to source their materials a lot more easily. So most of the homes are, in fact, getting the supplies they need. If none of them have that, I would recommend that they go onto the Department of Public Health portal, and there is a way to ask for equipment from the state command post. The other things that were pointed out in terms of testing, there's still 3 different ways to do testing in the senior care facilities. The National Guard, of course, is available. If people need that, they can call for them. EMS has staff that can come out. And the third way is they are starting to train some of our own nurses in nursing facilities. One of the things that we're now starting to look at is that this is going to become a permanent situation. So we're going to have to train staff who work in the facilities on how to do their own internal testing. And lastly, I am also still working on, there's a rapid response team. Brigida mentioned the Life Care Center and some of the others. There is a number for people to call if they really have a staffing crisis. Some of the graphs that she put up, you could see along with the residents becoming infected, and I've mentioned this in the past on my presentations, that also equates to staff being out on leave. So there definitely is still a shortage of nursing staff. For anybody who is interested, if you just Google search DPH COVID-19 dashboard, that basically you just put in, put in MA, Massachusetts Department of Public Health, COVID-19 dashboard in any of the search engines. They have just started to publicize part of the work in nursing homes. We want to be self-disclosing of all of the figures. So anybody who's participated in the testing protocol program is now going to have their data posted daily on the website. Right now, they just have hospitals listed. But you'll see the same information that Brigida presented for our local nursing homes, and that will be posted statewide going forward. I think it started yesterday, or it's going to be starting in a few days as soon as they get the nursing homes posted on there. So again, it's a good news, bad news. I think in general, the surge is hopefully looking like it's ending. We're containing the virus as well as best we can. And we did mention a shout out to Laurelwood Assisted Living in the Pine Hills and our own Plymouth Rehab, who've had 0 cases. So that's a terrific job to them. I'm available for any questions, or if anybody needs to call me offline, that's great, Steve. Thank you, Steve.
Thank you. Robert Eisenstein is a senior living consultant. We're now going to go to Stephen Cole, the executive director of Plymouth Regional Economic Development Foundation. Welcome, Steve.
Hi, Steve. Thanks for having me. Thanks for having me again. Glad to be here, and I will start my timer. I'm pretty sure I can get this information out to the community in about 3 minutes. It's important information. I want to make folks at home aware that the Boston Fed Reserve's New England Public Policy Center just released their latest update and findings on the COVID. I mentioned to folks a number of weeks ago, absent economic behavior, we have to rely on polls to give us a sense of what people are thinking and what their concerns are. I have no pleasure in telling you that about a third of all households in New England report a risk of unemployment affecting at least one member of their household. Okay. About 3% of homeowners report having trouble paying their mortgage, and about 13% of renters report having the same trouble paying their rent. That is during the CARES Act. Without the CARES Act, that number jumps to about 11% homeowners and 33% renters. About $1.5 billion in the New England economy is pretty evenly split between rental obligations and mortgage obligations. So about 750 less is actually rental, a little more than 750 million is actually mortgages. You can imagine the cascade effect when renters aren't able to pay and people who own those homes aren't able to then pay their mortgage. So we do expect some kind of a seismic movement in the housing market throughout New England. How, though, does this affect well, I'm glad I asked, because last time I was here, I talked about, or one of the last times I was here, I talked about this company I'm working with called Lend EDU. They were born out of the 2008 collapse. They exist largely to give folks who are seeking some financial investment or advice, some kind of nonprofit and sage information for how they behave in the marketplace. I just want to mention the last time they did a report for us, they found that Plymouth was actually among the most financially prepared residents for retirement throughout the country. We ranked 171st out of 25,000 cities. They just sent to me another report yesterday, and it is a sound methodology. They surveyed 25,000 cities nationwide. They looked at what they call the housing or home value investment indicator. What that basically means is that mortgage payments plus utilities are actually very competitive in Plymouth compared to the rest of the nation. So out of 25,000 cities, Plymouth ranks 362 out of the country and number 15 in Massachusetts. We're in very good company. Cities like Arlington, Natick, Beverly, they place just above us. Cities that we're all familiar with where money lives, like Fairfield, Connecticut and Stamford, Connecticut, they're actually below us. So despite whatever folks are feeling in the market, whatever folks are reading from these types of reports, I still maintain that based on the data, Plymouth is in a very strong position to come through this. And that brings me to my Twain quote for today. Twain's quote is, "Buy land. They're not making it." Plymouth is in a very stable environment in order to invest, both for housing and for businesses. Folks have heard me say too on this program that if you don't know that you're one of those thirds of households that has a job waiting for you when the lockdown is lifted, now is the time to start to think about the type of job you want to create for yourself and your friends and your family. It doesn't seem like a very confident or comfortable time to start a business, but you can start to think about that business plan. So I'll leave that there, Steve. I went over my 3 minutes, but I do thank you for the opportunity to share with folks today.
Thank you, Stephen Cole. And for those of us that live and work in Plymouth, we know what you said to be true. And Plymouth Representative Matthew Muratore, you rub elbows with lots of legislators throughout the Commonwealth. Is he speaking truth about Plymouth?
Well, good evening, Steve. I'm sorry, it's afternoon still, right? It's been a long show already. I'll try it quick. Yes, Steve, we are fortunate here in Plymouth, and I said this on multiple shows, how well we all kind of come together as a community, as leaders, as business community. It's different here. It is different. You can tell that when you go around the Commonwealth and see other parts of it. So we are very fortunate. I'm just going to really just go real quick with some of the stats on what Brigida had to bring up and Dr. Triffletti and Bob. With regards to the deaths, Brigida was correct. It's 10% of those tested have passed away in Plymouth, and the average for the state is 7%. The total is now 6,547 deaths in the Commonwealth. Those tested positive are now 94,220. And the weighted average is about 8%. So yesterday's total of positive tests versus those tested was 8% positive. So there's 4 key trends that we're looking at, and they are going all in the right direction. 7-day weighted average for positive test rate we look at, the 3-day weighted average of number of patients in hospitals, which right now the hospitals are down to almost 2,100 in the hospitals, down from almost 4,000 on April 23rd. So that's less than 2% of those in the hospitals with COVID-19 at this point. We also look at the 3-day hospital using surge capacity and the average number of deaths, which is still happening, but fortunately it's going down. Plymouth County is still at 7,656 confirmed cases with 530 deaths, and they're tracking the same as a Commonwealth, with 7% of those confirmed have passed away. When you start looking at those deaths by male and female, 52% are females, 48% are males. Deaths from previous hospitalizations was 55%, and deaths with involving health conditions, underlying health conditions, is over 98%. With regard to PPE, I know Bob brought this up. To date, since this all started back in March, the Commonwealth has delivered 12.3 million pieces of PPE. That includes masks, gloves, gowns, and ventilators to healthcare workers and facilities and first responders. And still going, as Bob indicated, they still have supplies if needed, but it is good to hear that there are regular supplies that are out there at this point. With regard to the state, what's going on in the state, we do have a new senator now, so I'm pleased to say that Senator Sue Moran was sworn in this morning at 10:15, so she will be on the show on Monday, so we'll have a chance to talk with her, and looking forward to working with her. We also have a municipality bill that passed the House yesterday that will move on to the Senate, and I'll speak to Senator Moran about that. It has some language in there about what you're interested, Steve and Ken, with regard to remote town meeting. It has information about financing, some updated financing language for municipalities, and also on elections. So we'll wait to see when that comes out from the Senate, how that's going to look as compared to the House. And if there are still ways that people can still help, donations are still needed. You can go to Mass COVID-19 Relief Fund if you want to provide some funds to that relief fund. 100% of it is going out to folks that are in need. And blood, I haven't talked about this in a while, but the Red Cross is in need of blood. So please contact the redcross.org if you can give blood. And that's the update for today, Steve.
Thank you. And that is Plymouth Representative Matthew Muratore. At this time, we're going to go to our question and answers. The first question is for Dr. Phillip Triffletti. Dr. Phil, you talked about states where people are not wearing masks or social distancing when bars or clubs have opened. And the viewer asks, how long might you think it would be before we see how virulent these situations might be?
Great question, and that's a question that comes up often. I would say, most experts would say about 4 to 5 weeks, because you're looking for sort of an exponential spread. And so, one person infects 2 people, and then 2 people infect another couple people. And so, the numbers start to just climb. But in order to really be measured, it probably would take about 4 to 5 weeks to see the impact of bad behaviors. And just another opportunity to emphasize, the good behaviors work, the social distancing, the masks, the hand washing, and that, it's disappointing to see when people aren't doing these things. And, I commend all of you that are continuing to do the right thing.
Thank you. And we're going to go back to our panel and circle back for final closing statements and today's takeaways. We're going to start with Brigitte Keene. She's the chair of the Plymouth Board of Health. Brigitte, what do you want people to remember today from your presentation?
What I'd like people to remember is what Representative Muratore said, and that the statistics are going in the right direction. So let's let them keep going in the right direction by doing the right thing. Wear your mask. Wear your mask. Wear your mask. Beautiful. Plymouth is beautiful in the summertime. You want to go out to exercise and walk outside, enjoy it. Put on your mask, enjoy it with everyone. and stay socially distanced. Let's keep our statistics going in the right direction and get rid of this virus in Plymouth and everywhere.
Thank you,
Thank you.
Brigitte Keene, and she is the chair of the Town of Plymouth Board of Health. Robert Eisenstein, you're a senior living consultant, gave us a lot of information about skilled nursing facilities. What should our community remember at this time?
I think very much similar to what Brigitte just said. It does look like the trend's in the positive direction. The only thing that I would caution, there's two sets of guidelines. One comes out from the federal government, CMS, but here in Massachusetts, our Department of Public Health has to interpret those guidelines for us. And they are actually a little stricter. So I would just ask for patience from the public and understanding, particularly the visitation restrictions that will most likely stay in place for nursing homes just until we get over this surge. And lastly, I would say, give a virtual hug to all the nursing home nurses and CNAs and housekeepers and maintenance guys. These are the guys sort of on the last edge of this virus. We've all seen what great kudos we're giving to the hospital staff, which I love. It's wonderful. I've worked there as well. But some of the nursing home people are kind of feeling left out. And if you see them or know them or have neighbors, please give them a virtual hug or a shout out on social media. They're really true heroes.
Thank you, Robert Eisenstein, senior living consultant. And again, congratulations to those Plymouth skilled nursing facilities that are currently testing with no positive cases. This time we're going to go back to Stephen Cole. Steve, we're moving on to June next week. And what do you have to say to our business community?
Well, it looks like, if Twain is any way correct, we're not making any more land, but some of us have more hair than we know what to do. So let's bring some of that attention to ourselves. If you have grown some crazy looking hair or crazy beard over this COVID lockdown, I want you to participate in a fundraising attempt that the Plymouth Economic Recovery Task Force is spearheading under the leadership of the Plymouth Area Chamber of Commerce. Send me your photo, send in a $10 donation, and we will judge you accordingly. There's 6 categories. Tomorrow we have the official launch, and so anybody watching the program at home is once again ahead of the curve with information. Stay by for tomorrow's broadcast. We'll have all the details you need to participate in our fundraiser. Thank you, Steve.
Thank you, Stephen Cole, Executive Director of Plymouth Regional Economic Development Foundation. We're going to go back to Dr. Phillip Triffletti, attending primary care physician, Beth Israel Deaconess in Boston. And Phil, what do you want our viewers to remember with today's presentation?
Well, I just can't resist the temptation to continue to really recognize our government officials, both at the state and local level. I think they're doing a terrific job. I 100% support, the phased reopening. I think it's very thoughtful. I think they're keeping the safety of the public in mind. This is a dangerous virus, obviously. We talked about a lot of people dying in our communities. And we are preventing many, many, many deaths by what we're doing right now. So I do want to commend them. I think they're doing a great job. I think while Massachusetts was a big hotspot, I think you're going to see that as this pandemic continues to unfold going forward, I think you're going to see Massachusetts is going to be a great leader in controlling this pandemic. And then lastly, of course, I just want everybody to say, life is different, but don't just count the days. Make sure you make every day count.
Thank you, Dr. Phillip Triffletti, attending primary care physician, Beth Israel. And we're going to move on to Representative Matthew Muratore. And Matt, Dr. Phil gave you a shout out as an official. What do you have to say?
I don't think he realizes I'm a Republican in Massachusetts. Do you know that, Phil?
That's okay. We'll take them all.
It's a great part about working in Massachusetts and being a public official. It really doesn't matter what you're a Democrat or Republican. And I had a constituent call me today that is very much a Democrat and just called to say thank you for the work that we've been doing, that Betty and myself have been doing, and getting back to people in a timely fashion and helping so many people out. It's just rewarding. And again, it doesn't matter if you're Republican or Democrat. It's all about the human spirit and helping people out, and that's what we do. That's what we do on a daily basis, and very proud to be doing that. What Dr. Phil is talking about, it's about data versus dates. And the governor has been very thoughtful in how he's going about this. We have been one of the 3 hottest, worst states, and one of the last states to start recovering from this. But I think the way the governor, lieutenant governor, and the advisory board are going through this, they're looking at the data every day. And as we talked about the key trends, the data that we talk about here on this show every day are all going the right direction. And we continue to wear the mask, as Brigida says, and continue the social distancing, even as we opened in phase 2. I think we will be ahead and be a model for the rest of the country and maybe the world on how we're actually doing this, and we'll continue to do this. And I just wanted to follow up. It looks like Bob watched our show yesterday, because that's how I ended the show yesterday, was talking about the nursing home folks. Those that are working in long-term care, whether it's a nursing home, assisted livings, or rest homes, they are just as much heroes as those that are working in the hospitals. And we really love the people that work in hospitals and what they're doing. But all those people in long-term care or hospitals, they are like the first responders. They are running into danger every single day. And they know that they're doing that. They're putting their lives on the line. And we should be shouting out to them, not just during this time, but we need to remember this after this is all over. And we should be treating nursing homes in a whole different light than we have over the past couple of decades. And I hope people will heed that advice and do that. You know, continue to stay informed of information that you're getting, whether it's through this show here, or through the local news, or watching the governor's updates on a daily basis. It's a great way to get information. You can go to mass.gov/COVID-19. If you have questions on anything, you can call 211. If you want to get text alerts, you can go to text COVID-MA to 888-777, or in Spanish, COVID-MA ESP to 888-777. Or if you have questions on your own health, go to bowie.com/mass. Continue to, particularly if you're over the age of 65, as you heard from some of these numbers from Brigitte and Bob, that the seniors are very vulnerable to this. You're over 65, please stay home unless you have to go to the grocery store or go to the pharmacy or whatever. But otherwise, just stay home at this point. You're the population that this is really that's suffering from this. Everyone else, if you are out, again, as everyone has been saying, continue to wear a mask, try to have some fun, stay calm, and remember, the more that we can all come together by staying apart, the faster we'll get back to the people we love and the things we love to do. And thank you, Steve, for all these shows that you've been doing, and to PAC TV. Again, another great silver lining in this whole thing is community access stations throughout the Commonwealth and what they're doing. And again, to all the essential workers working in healthcare, whether you're long-term care or hospitals or a clinic, thank you for what you're doing, and all those essential businesses that are taking care of our economic health. Thank you as well. And you all have a great weekend, and we'll talk again on Monday, Steve.
Thank you, Plymouth State Representative Matthew Muratore, and to all of our guests, Dr. Phillip Triffletti, Brigida Keene, the chair of the Plymouth Board of Health, Robert Eisenstein, senior living consultant, and also Stephen Cole, the executive director of the Plymouth Regional Economic Development Foundation, and Ken Tavares, chair of the Plymouth Board of Selectmen. You began today's forum and you led us in prayer to remind us about all those who have been so affected by this pandemic. How should we close out this week?
I think we can close it out in a very encouraging tone. The statistics speak for themselves. It is wonderful to hear that we're making progress, but we also need to keep front and center that this didn't happen by accident. It's the work of everyone on the front line, the back, and on each side of us that have worked so hard to make things happen. So I just say, people of Plymouth, stay the course. We are making great progress, and we will prevail.
Thank you, Kenneth Tavares, Chair of the Plymouth Board of Selectmen. You heard earlier that on Monday we're going to welcome to our presentation our newest legislator. She is Plymouth State Senator Susan Moran. She'll be joined by Sarah Cloud. She's the Director of Social Work at Plymouth Israel Deaconess in Plymouth, also by Michael Jackman from Congressman Bill Keating's office, Heather Cosby, Plymouth CPA, Michelle Brady, Director of Elder Affairs for the town of Plymouth, Amy Naples, the Executive Director, Plymouth Area Chamber of Commerce. They'll all be joining Matt, Ken, and me on Monday at noon. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us, and good day.